Welcome to the Dawn Jarvis Show with Dawn Jarvis, the diverse nurse. And in this podcast, we will be talking about healthcare, self-care, diversity, careers, and well-being from a Black woman's perspective. We're really happy that you're here. So if you're ready, let's get on with the show.
Hello, everybody, and welcome to the Dawn Jarvis Show. This is the podcast where I talk to busy leaders, professionals, and business owners, learning about who they are, what they do, and why they do it, and how they prioritize their own health and well-being and stay focused, positive, and productive. Today, I'm delighted to be joined by the amazing Dr. Behrooz. I met Behrooz initially on Clubhouse, and we're quite good friends now. And I'm also a member of his Intelligence Incubator. And today we are going to discuss how to launch a health entrepreneurship. So we're going to discuss that 90% of health is outside healthcare. Healthcare solutions need to take a life course. They need to be preventative and have an intersectoral approach, and that you don't have to be a health professional to get involved in improving and health and well-being. Hi Behrooz, how are you doing today? It's really good to see you, and I'm looking forward to our chat and all about what you're up to. So let me introduce you properly. Dr. Behrooz is also known as the Entrepreneur's Doctor. He helps entrepreneurs create a healthier and happier world. Behrooz is a Harvard, Oxford, and US CDC trained public health preventive medicine physician. He's also a Chief Medical Officer to startups and scaleups and creator of the Intelligence Incubator and the startup Therapy Accelerator, the world's first accelerator with the mission of democratizing health entrepreneurship. And you can learn more about that at www.entrepreneursdoctor. So Behrooz, this is very impressive, and I know that you're up to a lot. And what I want to know is, how did you get where you are today? I know a little bit about it, but I want to hear your story.
Dawn, I love you. I love what you're doing. So congratulations with the Dawn Jarvis Show. And honestly, I'm thrilled. I've been so excited to come onto this. And I'm glad we've been speaking before clicking record too. You know me by now. And when we met on Clubhouse back in, I think it was early 2020, wasn't it?
2020.
We were all stuck indoors. I was listening to Clubhouse, this new thing, and we had a few great conversations and we created a few rooms. But here's the gist of it. And I think you and I are on the same path, essentially. There's so many problems out there in health, aren't there? I mean, from chronic diseases to infectious diseases, we've seen the pandemic and all sorts of other things on the horizon too. But that's not to scare anyone. I think every concern that we see out there has a personal story behind it. And I'm happy to share mine briefly as we speak today. But essentially, I'm a public health doctor, as you've heard. And our goal in public health is improving the health of populations, of communities at large. And that obviously starts at the individual level. And the way we do that in public health is essentially maybe one or two things. Number one is, where's the need? Who actually needs to get various kinds of services? And they're not always healthcare services, which we'll talk about today. And then secondly, what's the best way that you can actually help them? And that's it. So there's various ways of delivering that. And for me, I do that in my day job, Dawn. I'm still a public health consultant part of the week, 3 days a week.
Yes.
But I've found that there's this missing link. Often the world of entrepreneurship is separate from the world of public health. We see, thankfully, more and more intrapreneurs, and that's what I've been up to now, intrapreneurs within the health sector, finding problems, creating solutions. But in the world of entrepreneurship, unfortunately, what I see is people are not always tackling what's needed. And if they are attempting to tackle what's actually needed to improve health, they're going about it the wrong way. And I'm sorry to say that, but that's my genuine belief. And
I think
so
you're right.
I want to bring the two worlds together. That's the bottom line. I'll pause there.
Oh, bless you. That's really good. And it's really interesting, because I think you're absolutely right. I genuinely believe that people who work in healthcare, they want to do the best thing, and they want to tackle what's, to make a better world. We've talked about sort of like being, right on, sort of like wanting to improve health and stuff like that. But are we tackling the right things? Are we doing it in the right way? Are we doing it in the most efficient way that will help the most amount of people, and then we're doing it ethically and authentically. I think that is so true. Now, you say that 90% of health is outside healthcare. I think I know what you mean by that, but it would be really good to get you to expand on that. What do you mean by that?
So this is one of the things that I see going wrong in the world of health entrepreneurship, but also maybe the world of health in general. Much of our focus and much of the money that's spent or the investments that's made are in the healthcare sector.
Absolutely.
So that's obviously improving clinical services, more diagnostics, more therapeutics, and it's getting more and more expensive. It's not even sustainable. But that's not the problem that I'm talking about. What actually drives our health? 20 odd years ago, when I finished medical school and I was starting to work, the thing that I saw on the wards in hospitals, this is up in Yorkshire, was that people were constantly coming into hospital, perhaps for things that could have been dealt with or even prevented outside the hospital. That's number one. And then secondly, we're often focusing on the wrong things, like what is actually driving those. So rather than just firefight and suppress symptoms, why don't we understand what are the drivers for health going the way it's going and actually address those? And this is, there's a nice statistic out there that shows what are the determinants of our health. And on one side, you see that about 10, maximum 20% of health is determined by having access to good healthcare, like doctors, nurses, and so on. But that's only 10, max 20%, right? The rest of it is 50% of it is our lifestyle, how we live our lives on a day-to-day basis. So fortunately, there are startups looking at that. However, there's still other elements there. There's the environment, the air that we breathe, the water that we drink, and not just as hazards, not just as pollutants, but also how can our environment be conducive to better health? And obviously there's another 10% or whatever, but it's genetics as well. But really it's how do we focus on not only what are the drivers, which are, as I said, outside the healthcare system, but also what are the even wider determinants of those? Like you and just for me, for example, me being able to go for a walk or finding healthy food, for example, isn't just my personal decision today. Yeah. And I'm going to pause there.
I think it's so true, because the wider determinants of health, it's your schooling, it's your housing, it's whether you smoke, it's around, as you said, around whether you can get healthy food, take exercise. It's about family, it's about community. And I remember when I started nursing, when God was a boy a long time ago, and we mainly worked with elderly people. And I remember one of the first things they said to us that most elderly people don't come to hospital. They're living by themselves, living their best lives at home, and that, coming to hospital or encountering healthcare is an emergency, for their parts of their life. And that when I worked in hospitals and I did mainly my clinical stuff in hospitals, you were just touching a very small part of their life and their health, but their health is at their home, and the main thing was getting them home. But how did, what was happening when they were at home was the thing that was going to determine their health. So I think that is so true, Behrooz, as well. So you believe that, and I believe too, actually, that healthcare solutions need to take a life course. So they're from, birth till we pass, that things need to be preventative. We want to prevent things happening rather than treat them when they happen. And you think that we need to take an intersectoral approach, and by that I believe you mean that it's all different agencies. So it's local authorities, local government, it's health, it's primary care, it's all sorts of things, it's businesses, it's all sorts of things, it's our communities. So I just want you to talk a little bit more about how your perspective on that.
Sure. So I think the way I'll answer that question, Dawn, is with the health entrepreneur, their perspective, that from taking it from that angle. So, and I'll be very honest with you, when I said most health is outside healthcare, the challenge is this. Number one, a lot of, as I said, funding. So although 10% of health is determined by healthcare, about 80-90% of the money that goes towards health actually goes towards healthcare. But it's not just the money. just imagine, like, you watching, listening right now, and I'm not going to talk about you, Dawn, because I don't know your health history, but with me, it takes an emergency, a personal issue, either on our own health or a loved one, to make us pay attention. And so often the starting point of any change in our health, sadly, comes when it is in the healthcare arena. So that's okay. So it's still okay to create solutions as an entrepreneur that are within healthcare, and then bring people out to where it really matters. So here's what I'm trying to emphasize with these three things. So when I talk about preventive, I think let's start with that. It's easy. Most people understand that prevention is better than cure. So why not create your products, your solutions as entrepreneurs that actually help prevent things getting worse and leading to poor health outcomes? And just, one or two kinds of ways of thinking about prevention before I go to the life course bit is, we often talk about prevention as if it's just eat an apple a day or do your daily exercise or sleep better and meditate, right? It's not always about preventing disease happening in the first place. There's other types of prevention, and you know this, Dawn. So we call that like primary prevention, avoiding disease in the first place. But the other one is creating things that help you detect a disease earlier, so like screening tools. And we see a lot of that startups are getting into. And then the third one is, okay, you're in the health sector, you know that you've got, God forbid, cancer or heart disease or whatever. How can you prevent that condition from getting worse? So there's all these three different, and there's a fourth that often people forget about. Medical error is a leading cause of problems. CDC ranked it in the top 10, right? And so this is the fourth level of prevention, which is medical harm by accident. Yes. People don't go out to do this on purpose. But so just parking that to the side, the other one is the life course. Most of us, let's say we see someone coming to buy your app, your service as a startup, or going to see a doctor. We start thinking, okay, they've got high blood pressure. Are they smoking? Are they obese? Are they not moving? And so on, all these lifestyle things. That helps. That really helps. And we shouldn't stop that. And I know that from personal experience. But it's also what happened early in life, and that your entire experience from not just your childhood and growing up, but actually what were your parents doing before they even had you, or even during pregnancy, right?
So true.
And then the final thing is the intersectoral one, Dawn, and I'll be quiet in a second, but you can tell I'm like really passionate about it.
It's perfect. It's perfect.
The intersectoral bit, just as I said, like 80-90% of health is outside healthcare, so too are the solutions. And so as a startup, you don't need to always be creating the next digital app or whatever that goes into the healthcare arena. You can be adding value by figuring out what is the problem, where are the determinants. It might be in education, it might be in social media, it might be elsewhere. And what's the best way to tackle that? It may be something that has got nothing to do with technology. And I'll stop there.
Oh, that's amazing. That's amazing. So so much to talk about there. So personally, and you're so right about that it takes a crisis to sort of like really think about sort of like your own personal health, but also to think about how you can help people as an entrepreneur around that. So for example, my sister unfortunately died of breast cancer when she was 26, 18 years ago. And this is we're recording this is October 2021, and this is Breast Cancer Awareness Month. So there's opportunities there to sort of like help people around prevention and sort of like looking for the signs and stuff like that. I also know that people from my community, women from my community, are more likely to have breast cancer. So there's work around information and around doing that, but also my time of life, so I'm at that age where there's things that you need to be taking a look now, hormones and everything like that, and menopause and stuff like that. So those are other things that with my knowledge and experience that I can sort of like highlight. So it's also things I need to be talking about as well. and the solutions around, the normal solutions around, that I am doing, like going to the gym, trying to do my diet and stuff like that, are things that, because I'm there, but that's also things that entrepreneurs can help people with as well. And I'm a children's nurse, that is my background, so that whole thing around that it's from your birth, and then and particularly what your parents are doing, and education around parents before they have children is so true. So I love everything that you're saying, and there's so many opportunities, and they're not necessarily in what we traditionally think about healthcare is, because healthcare is everywhere. Healthcare is in schools, healthcare is walking, do you have a supermarket that sells you nutritious food that you can get to around that as well. So I really love that. And you've talked about but it can be personal, but you also talked about you don't have to be a health professional to get involved and to be involved in improving health and well-being. And you talk about your work with startups, and and we're both in that world around working with people who want to help in health and well-being. So tell us a little bit about that.
Yeah, so Dawn, I think you saw this, about when was it? A few months ago, I made the split-second decision to talk about my personal journey, because often as entrepreneurs, we may not even see ourselves as entrepreneurs, but we go through some form of experience, either with our own health. I've had my own issues like burnout, for example, or asthma as a child. Or we see a loved one, like my dad, you've heard this, he developed like lung cancer essentially and passed away. Or same as you, unfortunately, I've had relatives and friends pass away. Just last week, one died of cancer as well. So we see this. No, I mean, this is it. So, but, we dwell, but at some point, done at the right time and well thought out, this can drive us. It gives us even more of purpose to do what we do and do even more of it. And honestly, that's what's been driving me for the last 20 odd years as a medic. And to be honest, it's, what I found was when I went through my own personal experience of burnout, I've had my own issues, who hasn't, right? But that split-second decision about over a year ago made me realize that I need to reassess and figure out how can I now help others avoid these things, whether it's burnout or indeed any of the other conditions that I've personally seen. So I went out and doing the 90-day challenge, going live on YouTube and the podcast every single day, highlighting those stories that I've seen as myself, but also bringing on innovators, entrepreneurs, change makers who've been through their own. One had breast cancer, a few others had other kinds of conditions, and it or cared for a loved one, and it all drove them to want to do something. And what I've been finding, Dawn, is most people, if that had happened to them any earlier in their life, they would have probably trained to become a nurse, a medic, a pharmacist, or whatever. But they're at this point, or some of them are even in their 20s, that they're at this point where they see, no, we feel like we can have more value at scale by doing something either as an entrepreneur and launching a venture. It could be not-for-profit, it could be a social enterprise, or as an entrepreneur within where they work already. But we want to actually identify the problem and create solutions. And so what I've been finding over the last year of doing the Entrepreneur's Doctor is most startups that are really successful and have real impact are led by professionals who are not necessarily health, not nurses, not doctors, not anything. They just have this purpose, this drive, and they then know who to ask for help from. They can lead it, they can orchestrate, they can compose and conduct the orchestra, this team, build a team around them, and then help them navigate the system. And I know that's where you specialize as well.
I know, and it's an absolute pleasure to work with people who have that purpose and mission, and through personal experience to want to help, and it's and we've talked about this, haven't we, Behrooz? It's like brilliant to sort of like to be able to use our expertise and our our clinical expertise and our experience of working in healthcare to sort of like help the greater good, if you know what I mean, which is that goes back to the public health model. as well. So that's wonderful, and you're doing some fantastic work there. I know you are. Behrooz, I'm going. You touched on it briefly. And you talked about the sort of the challenge that you did. So I'm going to ask you, how do you stay focused and productive so you can achieve your goals? And also, how do you manage your own health and well-being? Because it's like the doctor heal thyself thing. I know it is for me. It's sort of like, doing this work, I was thinking, well, yeah, I can't be talking to people about health and well-being when I'm not looking after myself. So I know I need to really sort of like put a focus on it. So how do you do it?
It's hard. It really is hard.
Trust me.
Where do I start? You kind of asked two questions. So one is, how do I stay focused on my goal?
Yes,
and then the second one is, how do I look after myself while I'm doing it? And
yes,
am I practicing what I preach? Okay, so let's start with the goals. It's hard. I actually did an episode on this as part of the 90-day challenge, but I think there's various ways that people talk about goal setting, these SMART goals that are specific, measurable. As soon as something becomes too structured, and I talk about structure and frameworks all the time, I think that's great. But when it comes to goals, personal goals, career goals, startup goals, family goals, whatever, they don't, at least for me, they don't work if they're just this like something that's on a piece of paper. I could put it on a wall, and I know a lot of people do that. I've tried it. That's, it's specific. I'm going to achieve this by so-and-so time, and so on. It just feels too detached from me. And so the only thing that I found actually helps me, and it has helped me, is attaching emotion to it. So I talked about this in that episode, but let me run through it very briefly with you, Dawn. The very first thing that I found helps is, first of all, understanding what does good look like for me, and actually feeling it, being in that moment. So that involves daily visualization and all that kind of stuff. You actually live and breathe that moment that is good, and that might change over time, and that's okay. But for now, you've got a clear eye on that, and what good looks like. But then you've got to come back to where you are today and really have a sense of, it's okay to be where you are. There's nothing wrong with that. But you've got to feel slightly uncomfortable staying in this moment in time. You've got to have this real desire to get to there and kind of feel like, in a daily way, like hungry and passionate and falling in love with where you want to be. And I think there's two other things that I want to add to that. For me, at least, it might be different for other people, I'm sure. It really does depend what drives you. But for me, that future vision only works if it involves helping other people. It's not just about what can I get for myself. So if I'm serving, and if I actually, this is still public health, what I'm doing with the Entrepreneurs Doctor. If I see myself helping entrepreneurs improve the health and well-being of people around them through their ventures, then I genuinely feel that I'm practicing public health in a much better way than just bureaucracy. I'll put that out there, right? I'm actually taking action with people who feel motivated, but don't just talk about it, they take action, right? So that's number one. And then the other side of it is, it's a daily exercise. So what I do every single day for 10 minutes, right when I wake up, is three things. The first one is it's this thing called priming. I think Tony Robbins or whatever talks about it. And he gets you just to be in touch with your physiology, so your heart rate and your breathing. So that's number one. The second one is you start appreciating three things that you truly love. And for me, it's without a doubt, it's the first moment I met my wife. The second one is that instant moment that my son was born. I remember that vividly, and I remember it every single day. And the third one is sitting with my parents at either side at 5 a.m., having coffee right before going to defend my PhD thesis. So I do that every day. And that's like practicing gratitude and centering yourself, knowing what truly matters. The rest is nonsense. And then the third one is visualizing, what is it, that goal that I mentioned, visualizing that on a daily basis so it sticks, but also having shorter term goals that, okay, you visualize what your day is going to look like and your week's going to look like. And by the time it gets to 8 a.m., 9 a.m., and we start the official day, things are so different, Dawn. And really, I don't see burnout coming anytime soon.
Oh, that's amazing. I love that. So I love that you sort of like, so it's a really good answer to the question about how you stay focused, positive, productive. And also you talked about visualizing and you talked about gratitude. So these are the things that people normally talk about, sort of like, but I love the way that you sort of illustrated it as well and talked about the things that you are grateful for, and actually sets you up for the day. And also I really loved how in the visualizing, you're sort of like feeling the emotion that how is that going to feel, what's that going to look like, and that's, you know, that's a real great technique, isn't it, for people, sort of like, what do you want to happen and what will that look like, and you know, how's that going to feel, because it gets you in the moment, and you can feel it, and it gives you energy. So I'm loving that. So we're now down to your health and well-being.
Right. That's tough. It really is tough. You know, where do I begin? Number one, I don't feel like, let's hit two birds with this one. The first one is tackling the, okay, why you not, how are you practicing what you preach, right?
Yeah.
I don't necessarily feel like a person who's been fit and healthy all their life is necessarily the best person to give advice to people going through health challenges. I genuinely feel, and I'm not saying that just because I'm struggling, but it might be true. I genuinely feel like to be a coach, to be a mentor, and I'm not a coach or a mentor, by the way, but to be a coach or a mentor or indeed a doctor, you've got to have the skill set, the expertise, the knowledge, but you've also have to be a good teacher and a mentor. And those skills are not defined by you having, you know, being the symbol of perfection. If anything, most people with symbol, you know, most doctors are not good teachers, unfortunately. And most personal trainers don't get down to the actual detail of what your struggles are if they haven't gone through it themselves.
Absolutely.
So what I find that's been truly helpful, and you know, Ed Jaffa, who helped me through 90 days on that challenge that we went live every day. What I found to be my stumbling block, and it still is there, it hasn't gone away, and it's a constant struggle every day, is mindset. And you know, without that mindset shift, nothing else will materialize. You might do it. You know, I lost 50 kilos a few years ago, and it's just been creeping back up. It's just been creeping back up. And you haven't changed what's up there. So he's been helping me behind the scenes to tackle that. And it's a constant struggle, which gets to two things. And I'll end here. Number one, it goes back to, this is not an excuse. It does go back to childhood. So really emphasizing this point that both as you, as an entrepreneur, as a health professional, if you want to really tackle these problems, go early in life and tackle the time when people are forming these habits, and go a step back to help the parents to create the environment for that child to develop those healthy habits. Go to the schools. Oh man, don't get me started, Dawn. I could go
do a whole thing on that. Yeah, we might do that actually.
We should, because I'm angry. I genuinely I'm angry at the way education is going. Anyway, that's for another subject. So
another day. Yes.
So going back to me and looking after my health, you know, if I may, just for a few minutes, Dawn, I just want to share, when I went through burnout, it was because the reasons for me was because I was taking too much on. I'm this kind of, you can see, hopefully by knowing me, if I see a problem, I don't just want to complain about it. I want to find ways to find solutions, right? I've always wanted to be an intrapreneur, and I still am. The challenge with that is, on the day job, for a busy job, you don't have the capacity. And if the systems are not in place to develop and flourish that entrepreneurial spirit, then you break, especially if you're like me. And there's quite a few people like me out there in the health profession. Last week, Dawn, I was at a summit that was about physician suicide awareness. I did not know that. So I haven't fortunately been to that point, but it could easily get to that point for many people, and the statistics are high. So really it's touching on, what do we need to set in place? And I took a step back and figured out kind of four things that I share on this 90-day challenge, 4 things that have helped me, and I think they help anyone. The first one is if you want to imagine your health as this house that you're building, right?
Yeah.
It's setting the foundation. So for me, at least, the foundation is your mindset, and it's the motivations, your inner desire. And we talked about that briefly just now. The second one is the architecture of that building, and that's developed through your eating habits, the nutrition, the food, the diet, and it's the patterns over life. Sometimes supplements might help, but the core, the foundation has to be right. The next up is the engineering. So this is like the plumbing, but I call this the actual things like brain games, physical activity, social activities, things that get you moving and learning and actually moving this body that you have. And then the last one is ventilation, which is your environment. So not only avoiding hazards in your house, in your workplace, in the community that you live in that are bad for you, and there's plenty of those, but how do you replace those with good things so that you can actually have a health promoting environment? And all of these have been definitely helping me, and it's the same foundations we use in public health services. And I'll stop there. I've been talking for long. So.
No, that's amazing. That is so good, because it sort of gives a framework for how you would look at it, and also talks about that. I think you are an empath, that you want to do things and you feel things and you want to help, but also that there's a potential cost to that, and that you sort of like need to help where you can, and we've spoken about this, haven't we? And that that there's only a certain amount that you can do, and that you do everything in your power. But the main thing I've taken from this is that in being an entrepreneur, in being an intrapreneur, being a health professional, whatever what is useful for someone, that the main thing is you have to look after yourself, because you are the person who's going to drive that forward. You are the person who's going to make your dream happen, and you can't do that if you're not well. And I totally take your point that health and well-being is a challenge, and there's lots of things that have impacted on where we are today, and that you can think about that, and but it's a journey, isn't it? And it's a journey to be the best that you can be, basically, and to do the most good you can do and help as many people as you can do. So that is absolutely wonderful. So thank you for that, Behrooz. So we're coming to the end now. So it's been a fantastic conversation. Is there anything that you want to sort of like leave the audience with? Sort of like, I know that you've written a book recently, and also that you have a program.
Yeah, so I guess thanks for this opportunity. Honestly, I love speaking with you, and I hope you'll come onto my podcast soon.
I will do.
So I think going back to this story of empowering change makers, I like to call them, because they can be health professionals, entrepreneurs, doesn't matter. But you see a problem, it's either your own problem or that of a loved one, or you might be in your work environment. You might be seeing problems that can come up with new ways of working, new technology, new solutions to help tackle that. How do you actually go about turning that into a venture that actually succeeds and is scalable? And traditional kind of business training programs take the business approach, the business framework, which works, and I'm learning those along the side for my own work as well. But what's often missing, even in your MBA programs at business schools, what's often missing in these incubators and accelerators is this approach that comes from a public health training that I've had. So the way I want to make sure everyone gets this and helps those change makers actually create solutions that not only solve the problem, but actually get adopted by the wider health sector, and that you can actually succeed in making it come to life, is to give that perspective shift, to start thinking like the health sector, to start thinking at the wider systems view, so that you can actually enter. It's along the lines of what you do too, Dawn. It's actually enter and navigate the system, but actually influence the right players too and speak their language. So the way I did it was, through the podcast, I bring in guests. I sometimes put my own thoughts out. And I just want to get this free. This has to get out there. This can be as free as it wants. But I wanted to put it into a very short book. I mean, this book, honestly, Dawn, you can read in under an hour. It literally is this perspective shift. That's all it is. And I really want this to be in the hands of everyone. And I initially thought of making this free. And people have told me, why don't you make this free? And the reason is I actually want this to, generate some income to go back to the drivers of what made me get into this, and perhaps others as well. So I've decided to take any sales it's on Amazon, it's on my website, and any sales will go to cancer charities to begin with.
Fantastic.
And then it's Macmillan, I think, the first one, and then we'll figure out where it goes next. Yes. But it's to go back to those charities that are doing worthwhile work in the topics that have driven us to get into this world of health entrepreneurship. So do check out that book. I'd love for you to get that.
Brilliant. Thank you so much. And you're available, your website, if you can tell the listeners what your website is, that will be really good.
Sure, no problem. I've tried to make it as simple as possible to be easily memorable, but hopefully you've got a link down below as well.
I will have a link down below. I'll have a link to the podcast and to the website as well, but it's www.entrepreneursdoctor.com. Is that right? So have I got that right?
It's entrepreneurs.doctor. That's all it is.
Okay, brilliant. And is there one last thing before we go that you sort of like to leave the audience and our listeners with from your perspective around health entrepreneurship?
It takes a team. It really does take a team. It's not you making change happen by yourself. We really need to, and entrepreneurship, Dawn, I think you and I have talked about this, it's a very lonely journey, especially if you're attached to the problem, especially if it's a health problem that you've gone through or a loved one's gone through. So all these emotions attached and all the wide skills that you need to make this come to life, I think needs a team approach. And I think I'd love to put this offer out there, and this one is free. This one, there's no cost to it. Essentially, I would love to invite you, anyone, to join me on this accelerator. So it's on the website /accelerator. Essentially, it's a way to bring people together who are entrepreneurs, intrapreneurs, but also mentors like you, Dawn. Also consultants, also investors, also health organizations, schools, all this wider sector approach that I talked about, to come up with and show their problems and have entrepreneurs and innovators come up with solutions. So I often see, and I'll leave you with this, I often see these very famous accelerator programs, incubator programs, or business training that sometimes are sold to you online at very high premiums, or they're free, but they take equity away, or they're very elite and very niche. I believe in those. We need them. However, I see power in letting the best rise, and I see power in democratizing this approach. So bring everyone together and let's talk. And so every Monday today, I mean, we're recording this on a Monday, every Monday at 5 UK time, we also go live on Zoom and we just brainstorm and bounce ideas, but it's a community offline too. So everyone's welcome to join that too. And I'll leave you there.
Oh, that's amazing. Thank you so much, Dr. Behrooz, for your time, for your wisdom and your advice, and the offers that you've made, and sharing your journey and what you're doing in the world. It's been absolutely wonderful. Thank you so much.
Dawn, I love what you're doing. Keep going. And if there's anything I can do to help, I'm here for you.
Thank you so much. And that's it today for the Dawn Jarvis Show, which is brought to you by dawnjarvis.com. Take care, and hopefully we'll speak again soon. Take care. Bye-bye.
Thank you for listening to the Dawn Jarvis Show. If you enjoyed this episode, there are 2 things you can do. Number 1, leave Dawn a rating and a review on Apple Podcasts. It would mean so much to her if you took a moment out of your time to post your thoughts on the show. It will help Dawn reach so many more people and help them with their well-being. Number 2, subscribe to Dawn's email list, the Diverse Nurse Digest, using the link in the show notes. Until the next time, thank you and goodbye.